Are you here for flu vaccine, Elizabeth? No. You're here for medicals? No. Medicals? You are sick. Wrong time. Wrong time.
Hi guys, good evening and welcome to the OSCE demo session by Nurses International. My name is Georgie. I am so happy to be here at this moment and I want to thank each and every one of you for taking your time out from your busy day to be here. I have with me our educators Geeta and Reena ma'am. So we will be talking about the different aspects of the OSCE exam that is conducted in Australia and what we do as a team to make your dreams come true for all the aspiring registered nurses overseas to be registered nurses in Australia. So once again, welcome everybody. And I know that you guys will have a lot of questions to ask. We are more than happy to answer all those questions after we are done with the talk. Feel free to ask your question. This is a safe place for your question. So no one's gonna judge you or no one's gonna say that that's a silly question. Geeta, why don't you introduce yourself first?
Hello everyone. My name is Geeta. I'm one of the educators with Nurse Assist International. So I've been with NAI. I have been fortunate to be working with NAI since we started the OSCE programs. So I work with NAI and as well as I work as a clinical nurse educator in one of the acute surgical areas in one of the hospitals in Sydney. Yeah, so it's good to be a part of the team, and yeah, that's about me. And as you guys, I have also been an overseas nurse in the past. So I have also had my journey of transition, and I've been working in Australia for the last 13 years now. Okay, so that's about me, and we'll chat a bit more later on. Thank you, Georgie.
Thanks, Geeta. Rita, ma'am, why don't you introduce yourself?
Yeah. So a very warm welcome to everyone and good evening to all those who have connected to us. I am Reena and I'll be one of the educators who will be taking the OSCE online sessions. So I'm going to be irritating you all with a lot of OSCE knowledge pertaining mainly, which will be helpful for you when you go to the simulation labs. And I'm very proud and happy to be associated with NAI since the inception of the OBA process in Australia. And NAI is, of course, one of the pioneer institutes to have started off with the OBA process. and the results are already speaking for itself. So talking a bit about myself, I am an educator, and I am working as a director of nursing education department in one of the renowned hospitals. Thank you.
Thank you, ladies. Thank you very much. Once again, I would like to welcome all you guys to this session. So let's begin. To start off with, I'll give you a brief introduction about NAI. Like Geeta said, we are all international nurses. So NAI was founded by international nurses to help international nurses to achieve their dreams of becoming an Australian RN. So Nurse Assist International was the first institute to start off with the OBA preparation training. So we've been there in this field since 2020, and we are so proud to be able to say that we've supported the nurses from the first take of Nclex, first take of OSCE till date. We have simulation labs in all the major cities in Australia. So we have 2 simulation labs in Sydney, 2 in Melbourne, 1 in Adelaide, and in Brisbane. So we conduct face-to-face trainings throughout the year in all our simulation labs. They're all well-equipped and state-of-the-art simulation labs. And we take pride in ourselves for letting our students use our simulation labs unlimited. So it's like 24 hours and 7 days a week. So if you choose to join NAI, you will have unlimited access to all those simulation labs of your choice, and every article that you need to have to ace your OSCE. So just to give you a perspective, so in the exams that was done in January and February 2024. In January OSCE, we had 69 passes out of 74 students taking their exams in Adelaide. And for the February result that came out 2 days ago, we have more than 68 students who have scored 10 out of 10, the perfect 10. And we have an overwhelming amount of students who have scored 9 out of 10. And I can proudly say that we're inching towards that 100% success rate in our exam results. I'm so proud to be here, and I'm happy that you guys chose to attend this OSCE demo session so that you understand what happens. So just to give you a brief outline of what we do for OSCE. So our OSCE training is online and face-to-face. We don't actually believing in teaching you driving online. So we will give you the tricks of the trade online, and then we will have a face-to-face session where we'll let you touch the steering wheel so that you master the skill. So nursing is a hands-on job. So you probably can't learn nursing by watching videos or by learning the theory online. If you take a trip back to in your memory lanes when you were being trained as a registered nurse in whichever country you come from, you always had student placements. And student placements is the time when we started putting our theory to practice, and we knew what we were lacking or what we were good at. That's exactly what we do. So your 3.5 or 4 years of nursing, we teach you that in 2 weeks of online training, and then 1 week of face-to-face training in any of the lab of your choice. We will let you touch that steering wheel and try and turn it to left or right. And when you need acceleration, we will be there to give you that push that will help you in achieving your dreams as a registered nurse in Australia. I am very proud to say that the numbers that I'm looking at is 6,000 plus. 6,000 plus students have invested their trust in us, and they're all registered nurses in Australia at the moment. And one good thing about getting this registration after OSCE is that is your stepping stone towards a permanent residency in Australia. As nurses, this is the right time to come in, and none of our students have ever had a problem with permanent residencies. And the employers that are tied up with NAI are more than happy to give weightage to our students and take them on board as full-time employees. Okay, so that is how we do our training. And I'll let Geeta explain more about the different topics that come in the OSCE. That is her expertise. Thanks. Thank you, Geeta.
Thank you, Georgie. So yeah, guys, so I'll just give you a little bit of a nutshell idea about, what we do as well. So when it comes to OSCE, I'm sure most of you would have finished your Nclex exam. So it's another challenging exam. And as Georgie said, it's really hands-on. So you can't be sitting at home and like watching a video and learning that. And because, including Georgie, all of us are like current, like we still practice, in the hospitals. So it's not like we're just teaching because we have like hands-on experience. So that comes very handy as well when we teach you guys, right? So myself, Preeti, Reena, we are all like working in different areas as nurse educators. Georgie as well, he works in mental health. So we all have like a wide variety of expertise. So what we try to do is we try to bring our strong points, together and work as a team and deliver that to you guys. Okay. So when it comes to your learning skills, as Georgie said, we offer you like 2 weeks of online sessions. So before you get onto the online session, we register you to our Moodle platform. So that's like a foundation platform where you have, like plenty of learning materials. So it's basically all your 3 years or 4 years of nursing material, all of that is summarized into a platform. So that gives you a good foundation and a good idea of all the basic things you need to know about the Australian practices. Obviously, you all practice in different places, different countries. So the forms are different, everything is different. So we have plenty of resources in Moodle. So you get a fair bit of an idea before you join our online classes. And then when you come to the online classes, we give you extensive 2 weeks of online classes where we cover a lot of topics. Like we do, a lot of forms. We go through the basic medication administration. We go through a lot of assessments. We go through just like all the basic skills you need, actually, wound dressing, different procedures, blood transfusion reactions, blood transfusion administration. So there's plenty of things we cover. So all those things, what we go through in the online exam is what I mean, online class is what we reflect in the face to face. So if you have a good foundation, when you come to the face to face, you have a fair idea of, how things work in Australia, and we demonstrate all the skills to you as well. So we just don't like get another student to show it to you guys or in the group. So we just make sure that we demonstrate each and every skill which comes in the OSCE, like 99.9% of the skills which come in OSCE, we demonstrate it to you. And if you have any questions, we still re-demonstrate that to you. And we are always accessible to our students. Like I always say, like, Preeti, Georgie, they're all like, their phone never stops. It's like a 24/7, it is like always loaded with messages and queries from the students. So most of us, like, are always available for you guys whenever you need as well. So that goes hand in hand with our online training. And so this training kind of like prepares you with all the skills you need it for like the exam. So basically, so as Georgie said, we make sure that we polish you in a way that whatever hard situation comes in the exam, we kind of give you a reality check during the face-to-face class. So you kind of know exactly what are the tricks and all those little things you have to be careful about, like as basic as like how to communicate, how to smile, how to say hello to somebody. Sounds all basic, but when you're in an anxious state, it doesn't come very easy. So what we do is we take that time to go through with you guys exactly, what is needed in the right amount to pass that exam, which is very essential. Because if you have too much knowledge as well, you don't know how to deliver it properly during the exam. So you just need the right amount of skills and communication and all that presence to kind of like get through the exam. So we go through in detail in the online exam. And once the online classes, I mean, or and face-to-face classes as well, both of them. And once we have done that, after the face-to-face, we just don't leave you. Obviously, you have, Georgie, Preeti, they are very kind to open their houses for you guys. I always say that our labs are like a place of worship for all of us, because there are so many dreams which have come through, true with NAI. So it's a very sacred place for us, our labs. So we kind of keep it as our home. And Georgie and Preeti, they are very kind to give that access to you guys after the face to face as well to practice. Our students are always there in the labs practicing. They access like, whatever kind of time suits them. There's a proper schedule of that. Everything is monitored. So it's pretty handy for you guys to come and practice your skills, because I really think that I've been an educator for a long time, and if you tell me to just watch a video and go and do a skill, I would not be able to do it myself. So we really believe in, like, getting your hands dirty and practicing there. So once you have had the practice, we still don't leave you there. We kind of hold your hands all through the journey, and we also kind of give you a mock assessment. And mock assessment, our students are always thankful for the mock assessment, because they go through that grill where they know how to face an exam. Facing OSCE exam is not easy, so you go through a lot of stress and anxiety. So that kind of give you a little bit of taste of how the exam is. And in the mock assessment, we cover up like almost like 10 station which comes in the exam. So that gives you a good idea, and you're ready to face anything out there. So that's just in a nutshell what we do. So as I said, like, if you we have as Reena said, that we have our results in front of you, so we don't have to actually bluff about anything. Even if you ask any of our students or see our Facebook pages or all our reviews, it all speaks for how thankful the students are to be a part of NAI. We actually call NAI as NAI family, because we treat everybody as family, and we believe in looking after each other. So yes, guys, if you join us, you have your best interest, and I'm sure you would have done your research. And we highly advise everybody to do your research and groundwork, before coming to us as well. And I'm sure if you do your research, you will not hear anything bad about us. Yeah, so that's about us. I'll pass it on to Georgie for now. Yeah.
Absolutely. Thank you. Thank you so much, Geeta. I don't think I would have been able to put it across as you did. So we are an AI family, and we take pride in the fact that we are a big family. Our family extends from Australia to South America to Africa to Middle East to Far East Asia. You name the country, we have had a nurse from there. Just to give you guys uh, an understanding, I'm going to play you a short video. Now, this will give you a glimpse of the passes that came through NAI in 2024. Let's have a look at it.
So high, I'm hypnotized. What's up is down, what's left is right. Chasing stars and holding you. I can't see the end, but we'll see it through. Times don't fly too high. Be sure to keep the ground in sight. Fly forever if you keep it tight. Love the world, but keep the sky on your mind. Flying, get on board. We're soaring.
That was the January passes for you from NAI. They all gave their exams in Adelaide. And that was an absolutely wonderful result that came for us and for them, for those students who put their trust in us from far off places. Now, a common thing that I get asked by students is, will I be able to do it? Now, all of us have our own, comfort zone. Now, OSCE is not an exam where you can pass it from by being in your comfort zone. You have to step out of your comfort zone. You have to step out and test the waters yourself. Now, if I'm going to tell you that, okay, say for example, you're from Middle East or from Philippines. Now I'm going to tell you, you stay in Philippines in your comfort zone. I'm going to teach you from here on how to ace your OSCE. Now, well, I don't think I'll be true to myself if I try telling you that I'm selling the product to you. Now, if I say that there is an exam in Australia that happens in Australia according to the Australian standards, and if I invite you to a session in Philippines that is conducted by someone over in Philippines telling you that this is how things work in Australia, oh well, I will take it in with a pinch of salt, because unless and until you're currently working in Australia, you do not know the standards that we keep work. So that's what Geeta was trying to tell you. Geeta works in one of the biggest hospitals in Sydney as a clinical nurse educator. Reena ma'am is director of nursing for education department for another big hospital, and I work in mental health in a regional hospital in Australia. So every day when you go in to do your work, you get to know what is happening, what are the changes that are coming into the healthcare, what changes are happening in Australian healthcare, what are the things that we are looking at, what are the possibilities there for nurses. So when we teach you that, it comes from first-hand experience. So when I tell my students, these are the things that you'll be able to do once you pass your OSCE, that comes from my experience, because I was an international nurse myself. And I always believe in, if I could do it, each and every one of you can do it. I'll let Reena ma'am talk more about the assessment part of things that we do in your OSCE, because I really don't want to bore you guys by telling everything by myself. If Reena ma'am can say some things, Reena ma'am. Looks like we lost her. Doesn't matter. So let us have a. Are there any questions from any of you guys till now? Everything that we spoke about, Geeta and I, we tried explaining about what we do and what we don't do. So if you have any questions, it'll be the right time to ask.
This is the joy sound which you will hear once you clear your exams. So we already have a green signal. That's a good sign. Thank you, Rachel, for that.
Reena ma'am, why don't you tell them about the assessment part of things that that is important for OSCE?
Yeah, so the assessments mainly will be, there are a list of skills that you all have to go through. And these list of skills, which we will be giving you a glimpse of these list of skills when you're doing the online session. So we'll sort of kind of make you thorough with the theory bit of it. So when you come for the simulation face-to-face, then you are already well versed with with the content or with the rationale behind each step that you are doing. So when you go to face-to-face, then there will be no extra time which you need to spare in order to learn or to understand the concepts behind each of the things that you will be doing. Yeah. So that is why we provide you an online session. And after the online, then we let you go for the face-to-face. That's where you will apply whatever knowledge that you have received in your online session. You will be applying it to practice when you will be going to the face-to-face. So that's how we are going. We usually do the pattern of how we work. And then later in my session, I'll give you a glimpse of how exactly do we conduct the session. So, you are well prepared for the simulation labs. Just as Geeta ma'am said, it's not just the content that we talk about. We also talk to you about from the time you enter into the station till the time you exit a particular station, right from saying hello to saying bye-bye, I will be there for you. We teach you everything. So right from start to finish, everything is taught to you in a way that you will be able to ace those skills which might look difficult at this point of time. It will be, you will be able to ace those skills within the 8 minutes of restricted time that is given to you. So that's how we prepare our learners so that they are able to ace things right from the time they enter into the room till the time they are able to leave, till the time they will be leaving a particular station. Should I give the demonstration now or?
Yes, ma'am. Please go ahead.
Okay. Okay. So, guys, what are we going to do is basically just to give you a glimpse of how our online sessions we conduct and how do we do it and how it's going to help you to make a decision is that's what I will be discussing with you. So I will give you a scenario. Now, before we begin the scenario, may I request all of those, I mean, all of you who are here, of course, we do believe in technology and technology bringing distances more close, I mean, making distances short. But may I request all of you, whoever are there on screen at the moment, if you can, please, put your cameras on so that we see each other, not because we are recording or anything, but if you can, unless if you're at your place of work, that's a different story. But if you can, please try to put your cameras on. All of you who are there at the moment, we have Krishja, Sapna, Devika, Georgina, Simi. If you can, please try to put your cameras on. Yeah, thank you for that. And this is how we do our online sessions. So don't just think that I'll be sitting in a different part, I'll be sitting in a different part of the world and the session is conducted somewhere else. So will I stay connected? No, this is how we ensure connectivity. And you will see by the different engagements that we do during the session, we make sure that we are connected, even though we might be separated by distance, but we definitely make sure that we are always connected to our learners so that we are able to give that one-to-one, one-to-one experience to each of our learners. Yeah. So, okay. So shall we get started just to see how the session will go on or how we usually conduct the session? Yeah. Okay. I think I need the screen sharing. Yeah. I don't know if Preeti ma'am or Georgie or someone.
Yeah, it is done.
Yeah. Okay. Thank you. So guys, this is a station where we are going to briefly discuss on how to do an A to G assessment for a patient. Yeah. And by now, if you have already taken a decision to go ahead with your OSCE, I'm sure you have already looked at the skills that APRA has set in for, right? And one of the stations that APRA has set for assessment. Yeah. So one of the stations which APRA has set for assessment is mainly the ABC or A to G assessment. Okay. Now, as Geeta ma'am has already told you, you will be having a total of 10 stations, and each station you will be given to a total of 10 minutes. Of the total 10 minutes that you have 2 minutes to read the scenario, which will be given to you outside the room. This scenario is basically the scenario about your patient. So a brief history of the patient, a brief detail of the patient will be given to you before you can enter into the room. And at the end of the scenario, then the task that is allocated or the task that is expected from you to be done, that will also be written. So when you go into the room, you are already prepared of what skill you need to demonstrate to your assessor who is present in the room. Okay. So the assessor might be just as a silent observer. There is nothing that you talk to the assessor. There is nothing that you will discuss with the assessor unless if you have some emergency. Other than that, there is no communication between you and the assessor. So apart from you and assessor in the room, there might be stations where you will have a simulated patient. Okay. So these are mainly standardized patients. These are actors who have been trained to do their role, because you may have a station wherein you have to do a physical assessment. You may have a station wherein you have to do a pain assessment. So there are these trained actors who are there in the room, and these trained actors will be, they are already given a script. Okay. So these trained actors are told when the student or when the learner is touching on your abdomen, you need to scream out with pain, scream out saying, I have pain. Yeah. Or if they are auscultating in the right place, then you're supposed to be coughing or something like that, you know. So these actors have been trained in a way that they know that if a student does a particular step, I need to do this. Okay. And so they'll be, just to depict true to the scenario, these actors will be doing their role. So you will have some stations where you will be having a standardized patient. You may have some stations which may just have a task trainer, okay, like a wound or something like that, just a particular trainer which is allocated just to do the task or to do a particular skill. Say, for example, wound dressing. So you may just have you may have a sacral region and you may have a wound which is present over there. Yeah. So something like that. So there are different types of stations. You may have a station which has a patient or a standardized patient. You may have an assessor who's present in the room, and along with that assessor, you may also have a second nurse who's present. Yeah. So the second nurse is usually present in rooms where they are highly specialized skills or medications which are mainly belonging to the high alert, or we call it as the A-pinch medications. So when you will be expected to do skills mainly related to A-pinch medications or high alert medications, then you will be having a second nurse who will be present in the room. Now, the second nurse is basically for you to cross-verify the medication order, right from prescription to administering the medication to the patient. You need to do certain checks in the presence of your second nurse, okay? So that's why you will have second nurse in some stations. In some stations, as I said, just the standardized patient. In some stations, you may just have the assessor and the task trainer. So that's how, in general, the different types of stations that you may encounter, yeah? So, of course, we will be giving you, when you come for face-to-face, we will be giving you an exposure to all these different types of stations, which you will experience during your real OSCE exam. So that's what Geeta ma'am was telling you. We do conduct mock OSCE exams, and these mock OSCE exams are very similar to your real exams. So there is, so usually what students tell us is the mock exam helped me to, you know, go through my main exam, because when I went into my main examination hall or into the simulation room, it did not feel anything different than what I did in my mock test, you know. So that's why we create a kind of, we already give you a preview of the OSCE stations before you can go for the real exam. And there is a one-on-one assessment which is done, and based on the assessment, we give individual feedback when you know, the mock OSCE simulation stations are conducted. Okay, so that's how we usually do the assessment, or how it will be in the real exam, the different types of assessments that happen. Okay. Now, just to give you a glimpse, as I was saying, you may have one of the stations where you have to do an A to G assessment of the patient. Yeah. So what do we mean? Or I'm sure we all have done. First of all, I forgot to congratulate all of you, because if you have reached this stage of attending the OSCE demo, I'm sure you have crossed the big hurdle of your Nclex, and Nclex is not easy. In fact, if you ask me personally, I would say OSCE is much more easier than Nclex. Because for OSCE, you have a structured pattern, you have a set of guidelines, you have a set of skills which you need to ace. That, of course, comes with practice. But when you go to Nclex, of course, you will echo whatever I'm saying. Because when you go for Nclex, you have head no tail of what to study, from where to study, what should I specifically focus on, what is something that can be kept optional. You have no clue whatsoever, yeah, when it comes to Nclex. But when you go for OSCE, you are already told that these are the set of skills and you will be tested on these skills. All that you need to do is practice, practice, and practice with the correct guidance. Yeah. So practice, of course, happens from your end. We will be providing you opportunities, a lot of exposure so that you can do your practice. And the guidance is what we are here for. Because just as we were saying, you may all be qualified nurses in each of your countries. But how to get that particular skill which you did in your country equivalent to Australian standards, that is what guidance will be provided to you on. Yeah. And of course, opportunities will be given to you. A lot of exposure will be given to you. just as Geeta ma'am said, the labs are open 24/7. Whenever someone wants to walk in, do practice a skill, we always provide unlimited opportunities. Yeah. Like we've had learners who 2 o'clock, 3 o'clock in the night, midnight, people are active. When the rest of the world is sleeping, our OSCE students are very much active in the simulation labs with their respective groups at 2 or 3 in the morning. So that's how the dedication and commitment from each one is. Yeah. And I'm sure all of you are also equally committed and dedicated to clearing the OSCE. Yeah. So, yeah. So may I ask, or if someone wants to volunteer, I'm sure all of you already know what is A to G assessment. We already get a broad overview of A to G in our Nclex. So what does A to G stand for? What does A stand for? Please feel free to unmute yourself, because this is not just a session for me or for Georgie or for Geeta ma'am, but it is mainly for all of us, right? And what do you say, a small myth is that those people who speak in the class, who talk in the class, are the ones who excel early, fast, okay? So please do not hesitate or stop yourself back. Please feel free to unmute, speak. And as we said, no answer is a silly answer, or no, we don't penalize anyone, or we don't criticize anyone. Yeah. So please feel free to unmute and tell us, what do you mean by A, B, C, D? Yep. I'm sure you might be aware of the raise hand button, which is there on the Zoom platform. So you can use that in case if someone is interested in volunteering. There's a raise hand button in case if you wish to use that. Yeah, Chris J. Chris J. Sorry if I'm pronouncing it wrong. Okay, Simi, what do you think is A to G assessment?
Ma'am, I'm not sure about all of the A to G, but A for airway, B for breathing, and C for circulation. Rest of all, I don't know, ma'am.
Okay, so D basically is disability, isn't it? But what do we say? We mainly focus, or we emphasize on neuro disability, okay? Because your brain is an equally important vital organ in relation to your heart, kidney. So your brain is equally an important vital organ. So in the D, we mainly look at neuro disability, or we look at, if the brain is being supplied with enough blood and oxygen. Okay, and what can someone tell us, what does E stand for? Ivan? Ivan, would you like to unmute yourself? Come on, guys. Maria, Smriti.
Hello.
Yes, please.
How are you?
Good, Georgina.
Exposure.
I am well,
Very
but
good.
I'm not sure what E stands for, but I'm just guessing here. I think E stands for elimination.
Okay. E mainly stands for exposure, as someone rightly mentioned. So E mainly stands for exposure, right? So we have looked at the vital systems, which is your airway, breathing, your heart, your brain. And then we go for exposure, wherein you will be exposing the patient gradually from head to toe, and you will be doing an assessment for the patient just to identify if there's no active bleeding, if there's no rash, and things like that. Okay. Yeah. And what do we mean by F? And then we have the G. Thank you for that, Georgina. Yeah, please feel free to unmute Rachel, Diane, or Devika, Sapna. Yeah, would someone would like to try? Please unmute yourself. Don't feel shy. F mainly stands for the fluids, okay, or the fluid status. Yes, that's your, when you talk about F, it's mainly the intake and output. And what do you mean by the G? G mainly stands for the glucose control, okay, or mainly your glucose levels, your blood glucose levels are that is what is covered, will be covered or assessed in the G. Yeah. So this is just a glimpse of what you mean by A to G. Now let me give you a scenario, and let's see how we will be able to do an A to G assessment for this patient. Devika Madanan, would you be happy to read the scenario for us, Devika? Devika or Maria. Guys, don't make me feel that I'm alone here. Come on. Rachel. No one? Vishnupriya. Come on, Vishnupriya can definitely do it. Yes, thank you so much, Maria, for that. Yeah.
Okay.
Yeah.
So Miss Andrea Melwit, 56 years old, female, is admitted in surgical ward due to acute pancreatitis, appendicitis. She is diabetic on tap glipizide 2.5 milligram OD before breakfast. She underwent a successful open appendectomy on the same day of admission. There are no other relevant past medical history. On day 1 post-op at 6 a.m., the observations are RR20 CPM, SpO2 96% on room air, BP 97/47, HR 110 BPM, temp 37.2. She is alert and oriented with bilateral pupils, 3 millimeter equally reactive, mild oozing noted from post-op site.
Okay. Thank you so much, Maria, for that. Georgina? Georgina?
Yes.
Yeah. So, Georgina, imagine you have been given this scenario outside. Okay. So, you have read about the patient and now you're going to enter into the room. So, I'll be Andrea Melvit. Tell me how you would go about with your A to G assessment.
Okay.
So, I'll be Andrea Melvit for you. Yeah. Let's just quickly do it, run through it. Don't worry, because of course, only when we make mistakes, we learn. So don't be scared of making a mistake, because everyone learns from making a mistake, right? We learned cycling only because we fell so many times. So don't worry about it, okay? Go ahead. I'm Andrea Melvin and I'm sitting inside the room.
Good morning, Miss Andrea. How are you today?
Yeah, good.
How are you feeling?
I feel a little bit of, discomfort. I don't know if it is because I have not passed stool since the last 2 days. Is it because of I don't know, because of that. Maybe I feel a little discomfort.
Okay. Are you breathing well? And
Yeah,
are you feeling any dizzy?
No, I don't feel anything. I'm absolutely fine. I'm breathing well.
Okay.
But by the way,
Can
may I know who are you?
Oh, shit. Okay, my name is RN Georgina. I will be helping you today and assisting you throughout the day. If you need anything, I will be here for you. Please don't hesitate to talk to me if you feel like talking to me about anything.
Oh, that's nice to know. Thank you, Georgina.
Okay, so Mrs. Andrea, I am going to check the operation site to see what's happening there.
Yeah. I do feel a little wet over there. I don't know. Yeah, that will be nice if you can check there.
Okay. So then I will check but I think before I do that, I need to do the observation. Oh, the observations are already there.
Okay.
I'm not sure because I'm worried about the blood pressure that is 97/47. So, but I don't know how to manage it. I'm not sure if then we are supposed to put up IV fluids. I don't know, but I will check the upside to see if there's any bleeding.
Oh, nurse, I see that there is some bleeding. What happened over here near my dressing? I see that there are some there's some drainage here on my operative side. What happened?
Okay, you went for appendectomy yesterday,
Yeah.
and for appendicitis.
Yeah.
So now it is expected that there will be some bleeding, but not a lot of bleeding. So let me just check and find out what's going on.
Yeah, because I feel it's like almost wet. Oh, this cough is bothering me since morning.
Okay, is it painful?
Yeah, because of the coughing, where I have been operated, that side also pains a lot, and this cough is just annoying me.
Okay, so let me just remove the bandage and see what's going on.
No, sure. Please.
Oh, please, I'm done. I can't do this. No, I think someone else can try.
Okay. Devi, Karma Chodhan, would you like to pick it up from there? So she has opened the dressing, or anyone, Ivan, anyone for that matter. Please feel free to pick it up from Maria, because she feels quite, Georgina, she feels overwhelmed. Yeah, Ivan, would you like to take it from there? What would you do in this scenario? No one? Simi. Yeah. Yes, Maria.
Since she opened the dressing, I could take note of the amount of oozing and the color of the oozing,
Mm-hmm.
and then ask what did she do beforehand? Before
Nothing. I didn't do anything. I've been resting, Sister Maria. I've been resting. Nothing else. I didn't move around or walk around.
Okay, and you said that it hurts here around your
Yeah, my
wound?
throat. My throat hurts. Yeah, and whenever I cough, it does hurt there. Yeah.
Okay, so I'm going, since your RR is within normal values, your O2 is within normal values. So airway is done, breathing is okay. Circulation, I see that you're 97/47.
Mm. Yeah.
Yeah. So breathing is good. Circulation, she's hypotensive.
Mm.
She
Yeah, so
seems
you are with
within.
me. You are with Miss Andrew.
What was
Miss
that?
Andrea. Sorry. You are with Miss Andrea. So are you just going to document with Miss Andrea looking apprehensive of what's happening around her?
No, I will give her. Don't worry, Miss Andrea. I'm going to relay these findings to your doctor. So just stay put. I'm going to raise the foot of your bed, and I'll be back for you.
Okay, thank you, Sister Maria. That's such a relief to hear and very helpful from you. Thank you so much. Okay, so thank you, Maria, and thank you, Georgina. Do you guys feel confident with the station? Do you think you were able to do all the assessment?
No.
No,
No,
right?
not yet.
And
I think
here itself, we have taken 10 minutes wondering and figuring out what to do, right? So that's how we'll be, teaching you for OSCE. We'll be giving you a script, entirely a script, right from the time you enter, as we said, till the time you leave the room. Now, you walked into the room. What some of the pointers which I would like to highlight from this scenario which just happened. It's not pointer. I mean, it's not something to critique on, but just few things that we should, just an eye opener for us. Did we do hand washing when we entered into the room?
No.
You are opening my wound. Did you pull the curtains to ensure that you are providing me privacy? Did you check on the patient identifiers? Yes. Forget the skill, forget the A to G assessment. But these are certain things. Are they important or no? Or can we just go, oh, I saw your name outside was Miss Andrea. So yes, Miss Andrea, how are you doing this morning? Probably I am disoriented. I am another patient who just walked into this room and I saw the bed very cozy and I just lie down there on the bed. Did you check with me if I am Miss Andrea? I would have just, probably my name would have been Angel or whatever. And I just am overhearing you saying Angel, even though probably you might be calling it out as Andrea, right? So do you think it is very essential and important to check patient identifiers? Yeah. So these are some crucial things which we missed. And then, of course, the skill you will gradually learn. So we don't just say for breathing it is good, but there are terms which we will use specifically to tell that breathing wise he's comfortably breathing, or the bilateral air entry is equal, the chest rise and fall is bilaterally equal, you know, those kind of things. Yeah. Yes, you did identify that the patient was coughing and then there's oozing. Did we do something about it? The easiest thing to do would be, Miss Andrea, whenever you're coughing next, make sure that you are splinting the surgical site, isn't it? Yes or no? Does that require a lot of effort and this one? No, right? So these are some things which you will learn, of course, by practice, and we will guide you through. We will be giving you a script whenever. So as I said, right from the time you enter, hello, I am so-and-so, and I am the nurse who's going to take care of you. So while I'm doing this, my hand washing is on the process. I'm going to pull the curtains. So, you know, everything happens in a fraction of a second. All the things are covered just to make sure, because what is OSCE looking at? OSCE is mainly looking at if you are able to practice as a safe nurse for your patient. The most important thing that is looked over here is, are you safe for your patient? That's why it doesn't ask you to do complex skills. It does not ask you to do skills which only a specialist nurse or a specialized nurse can do. It only asks you to do basic skills where through the skills they are able to identify if you are a nurse who is safe for your patient. Yeah. So that's what OSCE is going to look at. And then, of course, we, through this scenario, within that 8 minutes, we were not able to assess the neurovitals of the patient. Yeah, so that could have been easily done by asking, when you looked at the patient identifiers, and if you would have asked her, could you tell me your full name or what's your address and things like that, then, you know that neurovitally the patient is stable. Yeah. So, sorry, Diane. Yeah. So those are the things which, in a nutshell, right now we identified that we were not able to do and which are very crucial, which need to be done from the OSCE point of view, especially the assessor is looking. The assessors are mainly standing with a checklist in front of them. And on top of the checklist is hand washing, respecting the, dignity of the patient, which is basically by providing privacy, identifying your patient using the identifiers. So those are the top 4 or 5 things on the checklist, right? And then only your skill starts. So don't worry, when you come for OSCE, we will give you the entire package. Yeah, right from what you talk to the patient till the time you exit, and what will you tell the patient in case if you have identified some abnormal findings. Just as over here, we have identified there is a mild oozing, there is hypotension. So I'm going to tell the patient, I have observed that that you have got hypotension, there is oozing from your surgical side. I'm definitely, just as Maria pointed it out, we will be escalating these concerns to your physician so that we can provide you immediate attention and immediate help. Yeah. So, of course, then these findings, you will be communicating with your physician or whoever, which of course is another part, is another station, which is mainly through the IS bar tool of communication. You will be conveying this message to your physician. Yeah. And how to do IS bar, what's the proper way of doing IS bar, everything will be taught to you by our educators. Yep. So this is just a glimpse of how we do the sessions. We will be giving you scenarios. It might look online, but we will be giving you scenarios. We will be having a lot of practice where each of you will be given, examples, scenarios where you can actually demonstrate the skills or verbalize to us, just as you did. You walked into the room, you said, hello, Miss Andrea, and things like that. So we will be giving you opportunity to practice even though it might be an online session. And then, of course, whenever you come face to face, reality will hit you hard. So whatever you have learned in the online sessions, you will be able to apply it to practice when you come to the simulation labs. Yeah. Do we have any questions from anyone? Please feel free in case if you're working and if you want to, drop your queries on the chat box, please feel free and we'll definitely answer your concerns. Thank you.
There were a couple of questions in the chat box. I would like to answer them. There was one particular person who asked whether they'll be able to secure employment during OSCE. Now, let's be honest, guys. If you're an onshore candidate, if you're in Australia already on some type of visa, say a student visa, yes, you will be able to secure employment while you're doing OSCE and you'll be able to fund your life in here. Now, if you're an offshore candidate, the only way you can come over to Australia at the moment is a business visa or a visit visa. You do not have working rights at that time. But when you are doing your OSCE with us, we can link you with potential employers who are going to offer you a job, provided you get the Australian registration. It works that way. I have seen students getting placed that way as well. Now, once you have given your OSCE exam, there are a lot of employers who would actually interview you and offer you an employer-sponsored visa, or some of our students have even managed to get a straight employer-sponsored permanent residency as well. Okay, so that is the truth. If someone says that we're going to offer you employment while you do OSCE, I would think twice and I'll do my research, just like Geeta said in the beginning. Do your research thoroughly and don't fall for scams. Another question that I saw there was, can I finish my face-to-face in 3 days instead of 5 days? Now, at NAI, we are going to teach you around 28 to 30 procedures. Now, I don't think it's humanly possible for you or me to be able to teach students 30 procedures in 3 days. And moreover, APRA is going to expect a lot more from you rather than you having a short course of studies. They might ask you questions during your OSCE exam about the theory part of things. The patients are known to ask questions to the student registered nurses who are giving the OSCE exam. So we will make sure that you are well capable of answering all those questions. That's why we stretch this face-to-face from 3 days to 5 days. So sometimes our students say that 5 days is 3.5 years of nursing in a concise form. Now, we are not going to teach you anything that is unnecessary or if it doesn't come for OSCE in your OSCE exam. We have been updating our syllabus over the past few years, looking at the way things are being done, looking at the questions that are being done. So we know exactly what we are teaching you, and you will be well equipped with knowledge. And when you face that examiner in your OSCE exam, you will be beaming with confidence, and your competency would be at the highest rate after doing all that practice in our labs. And I'm sure Geeta will be able to explain that in a better way. Thanks, Geeta.
Okay, thank you, Georgie. So I cannot emphasize the importance of practice because practice is so important, guys. So unless you repeat that skill over and over again, it doesn't become like a second nature, So it's kind of like the challenge here is because you do kind of different practices, back in your countries, to relearn them and get into that Australian skills, what are required, what are the gaps you have to work on. That really needs a lot of practice. And this a lot of our students, as we said, we don't leave their hands even after they pass the OSCE. We still keep in touch with our students and they approach us for interview reference. We all have given so many references to the students, so they always say that this 5 days what they have learned is not just preparing them for the OSCE, but also to kind of like face the hospitals in Australia, because it's quite challenging and overwhelming. So they have used all their knowledge from the online classes and from the demo classes, and were able to clear the interviews for their jobs after the after the exam as well. So it actually, and I really think I've been an educator for 13 years in Australia, if you ask me to teach you everything in 3 days, I think it is impossible. It's absolutely impossible. And you need to get like really, really, thorough with everything. You need to know the right amount of stuff you have to perform and say in the exam. So we don't, and as educators, we don't want any like any gaps to be left as well. So we prepare you for actually for a war where you are like equipped with everything, so you're good to go, and there's no like room for any errors. So that's what we do. And also guys, with this is a very common thing which we have seen, because we have been very fortunate, as Georgie said, to train thousands and thousands of students. And if you see, we always have a big intake of students, but we don't take it as a drawback, but we take it as a pride. Because, for example, if you go to a hotel or go to a holiday place or go to a restaurant to eat, you would go and look at all the reviews, right? And you don't go to a restaurant which has less than 5 star. I would not go because I don't want to risk my health, my money, everything. So when I look at a restaurant, I will look at, okay, how is this restaurant? Has it got, how many reviews has it got? I'm going to do my research. I see, okay, there's like 5 out of 5 stars, and go and have a look at our reviews. You'll get that and beyond that as well, because the students appreciate all we do for them, and NAI does. So it's a teamwork for us as well. So once they have done their research, once I have done my research, I go to the restaurant which has 5 star and with a lot of people in it. So that's exactly what happens in NAI. Everybody comes to NAI because they know that they will get the value for their money. Like they trust, they put their blood and sweat in NAI. They trust us, and then they know that the results will be given to them. So if you think that, as we said right from the start, if you think that you're going to drive or swim just watching a video, it is not possible. And it is a very sad that so many people put out the procedure videos and blogs and stuff where they are not even trainers. So I don't know if you guys know that if you have to teach and be a trainer in Australia, you need to have certain degrees under your belt. So all those people who are doing all these videos in the YouTubes and the blogs, they don't have any kind of like certifications or training. But we in NII, we are very fortunate to have a good group of team educators who have certifications under their wing. As Georgie said, we are all current practitioners, so we know exactly what happens. What does that take, what is that extra bit, because there is so much competition, isn't it? There is hundreds of students doing the exam. So why would an assessor choose that one student to pass the exam? That one student, which is you, need to stand out. So what are the qualities to stand out? We also teach you that in NAI. And we always, no matter how many students we have, we are always reachable to them. Anytime, Georgie, Preeti, myself, like, Reena, we always make sure that we are available for the students. And we always supply the students with articles. There's no scarcity of articles in the lab as well. So our students have said that our labs are even well equipped than the OSCE real stations as well, after they finish the exam, or they always tell us that. And they always say that because they have done the mock assessment with us, so when they go and stand in front of an assessor, they just feel like they are doing assessment in front of us, because they've already had like a taste of how an assessment is. And Georgie always provides, like, if you want a practice pack, Georgie always provides you with a practice pack. Everything is there, guys. You just have to kind of get in the lab and practice. So yeah, so what I'm trying to say is, like, it's a good environment for you guys to learn and practice. And I would also tell my own journey with NAI, because I feel like it is very important. Like same like you guys, right? When I look at being an educator in an institute, I'll do my research and I'll look at few institute and I'll say, okay, whether do I want to work here, whether do I want to work here. So when I looked at NAI, what standard out for me was NAI is like a family. So it's a very strong bonding for us. And then we believe in being there for each other and spreading that positivity. And we have changed a lot of students life, and that is our motivation as educators. If you ask, that is our biggest reward, which we kind of like are always proud of. So yeah, if you join NAI, I'm sure you will never regret. So feel free to ask Georgie any questions, and like try and get in touch with us. I think the mobile numbers and the email addresses, everything is there on the screen as well. And feel free to ask Georgie the questions, guys. This is your perfect opportunity rather than just like hearing from people. Georgie is there right in front of you. So feel free and don't be shy. Just ask whatever questions you have. Okay. Thank you, Georgie.
Thank you, Geeta. Just adding on to what Geeta said, it's not about just teaching you how to ace OSCE. So I have a student with us right now. So we get a lot of couples, as in the husband and wife, they choose to come together, or either the husband comes first and then send the wife, or the other way around. So there is this lady who is doing her OSCE in May, and I just met her during the face-to-face in Melbourne. She told me, "Hey, you know what, Georgie, sir? My husband did the OSCE with you, and he's got the PR last week. So he's in Perth at the moment." I was like, "Brilliant! That's great news to start off a day with." And then she told me, not only that, I want to tell you that he got honored by the chief executive of the hospital for being the best nurse on that ward for the nursing service he has provided. And it was just after 2 weeks into his job in that hospital. So that is what we try to make you. We want to make you the best nurses that Australia can ever have. So I remember another Nepalese student who studied with us. She had really bad experience before with another institute, and then she came to us. She passed her OSCE, and she's in Tasmania at the moment, and we still keep in touch with her. She's a family. So she told me that her workplace was undergoing an inspection, and when she went into a patient's room in the morning to do a vital signs, there was another person sitting in the room. The other person was very quiet but very friendly. So she introduced herself and she did the procedure and she finished her shift. She came home. And in the evening, she got an email from our director of nursing congratulating her. And the other person sitting in the patient's room was supposedly the person who was doing the inspection. That was an inspector. And that inspector was so happy the way she delivered the patient care. So one of the comments in that email said something about she is a wonderful nurse who works with the principle of patient-centric care. The center of the care was always the patient. She dealt with the patient with utmost empathy and kindness. And she was such a pleasant vision to watch while she was doing a procedure. So that is what we make you. It's just not just about passing OSCE, but about your future career in Australia as well. Now, I have some other snippets for you as well. To begin with, I want you guys to have a look at one of our passes from February. And I just have highlighted the part where he has mentioned something about his training with NAI. I'm going to share the screen now. Just bear with me for 1 second. Yeah. So his Facebook post is on your screen at the moment. So I'll just read it for those who are not able to read. I extend my heartfelt appreciation to my classmates who became my friends at the Review Center, particularly Nurses International, to our educators, and to everyone who has supported me with their love and unwavering encouragement. Without your support, I would not have passed and aced my OSCE examination with a score of 10 by 10. So that is just one student. So I have counted up to 68 students in the results that came out a couple of days ago. So this is what our students feel about the training, about the life in NAI. So he was referred to our institute by his wife, who apparently did her training from a different institute. So the wife said, okay, you go to this institute and do your OSCE. And she was right. And he proved her right by scoring the perfect 10 out of 10. Now, leaving that, I'm going to show you a small snippet out of the life of a student nurse who is an aspiring student nurse who is actually joined NAI, and a day of her life when she was preparing for OSCE. Just bear with me, I will get it.
lonely. It isn't easy when you're all by yourself. Don't you worry, I hear you, 'cause I know what it's like.
So that is one of our Filipino students who came straight from Philippines. Now she's a registered nurse in Australia. Now she will be fixing her life in here. She'll be bringing a family. She's going to be settled in Australia, and she will be enjoying that life she always wanted. I'm very proud to see that video again and again. That is another success story that we have. And I just want to show you a simple snippet of our new lab in Melbourne. So we have 2 labs in Melbourne and 2 in Sydney. I just want to show you how the new lab looks like. For those who have not or are not following Nurse Assist on Facebook, I would strongly recommend you guys to have a look at it. That's our new lab. Yeah, that's it. So as you can see, it's a massive space, and we have plenty of space. So that, like Geeta said, if a restaurant is serving the best possible food that can probably buy in the market, there'll be a lot of customers. So we have not let any of our customers down. When I say customers, our students. So most of our students, they come from word of mouth from their friends or families who have had experience studying in NAI. So I don't think anybody would be saying anything that is untrue to get their family or friends enrolled. So, like Geeta said, do your research, guys. Ask around to those who have attended their OSCE training with NAI and those who are past. And I'm sure you'll find thousands and thousands and thousands of NAI babies out there in Australia. Our dream is to have one registered nurse in every Australian hospital who is trained by NAI. And we are kind of getting closer to that dream come true. So that is a proud moment for all of us. And there is, for those who are, I would strongly recommend you to come and join us straight away. Our face-to-face sessions are going on, and we are preparing for the May OSCE exams. Students are practicing really hard in our labs. There are group offers going on at the moment, and we offer installment plans to students. And another thing is, if you're planning to join after watching this this video right here, please mention that in your email when you contact us. The email address to contact us is admin@nurseassistinternational.com. And you can find all this information on our website and our contact information, including the WhatsApp numbers, the phone numbers, email addresses, and everything. So please feel free to get in touch with us. We have educational consultants who would be more than happy to assist you with your questions. Like I said, they'll be more than happy. I will share that contact information towards one more time towards the end of this meeting. Now, before we conclude, I would like to thank all of you for taking time out to come and listen to us and see how things are done in NAI. I would like to extend my thanks and warm regards to Geeta and Reena ma'am, who took time off to be a part of this this presentation. Thank you very much, guys. Thank you all. I'll just say it once again. You can contact us at admin@nurseassistinternational.com, or if you are looking at WhatsApp phone numbers, it's being displayed on the screen as we speak. It's +61 478 320 397. I say that again. It's +61 478 320 397. You can take a screenshot so that you don't lose it. And please make sure you mention that you are signing up after watching this live so that you can avail of the discount offer that's going on. Geeta and Reena ma'am, is there anything that you guys want to say?
No, thank you everybody
All
for
the best.
joining. Just don't waste your time. You know what is the right place to go, and we will look after you. All the best with everything, guys. Thank you. Thank you, Georgie. Thank you, Reena ma'am.
Thank you,
Yeah.
Geeta, and thank you, Reena ma'am. Yeah, Reena ma'am, you were about to say something.
Hello.
Yes, Georgina.
Yeah, so I was just saying that make your right decision, your wise decision. And remember, NAI gives you value for every penny that you will be shelling out from your pocket. So, take it written from us. Yes, Georgina, you were saying something.
Hi, how are you? So,
Georgina, how are you?
Yes, I would like to do this with you, but I just want to clarify two things. Number one, you will be doing the online sessions between 6:30 p.m. and 8:30 p.m., which is around about this time. In Africa, it's 11:27 a.m.
Okay.
So I wanted to understand, is it a 2-hour session or is it an hour session? The
It's a
online
2
session,
hours to 2.5 hour session.
2.5 hour session. Okay. Then the other thing, for us international nurses, you said that we need to be in Australia for 3 weeks, if I'm not mistaken. So we'll do 2 weeks of face-to-face learning, and then 1 week is for exams. Is it correct?
No, Georgina, it's the 2 weeks is online, which you will attend from, say, Africa in your case. And then you come down to Australia for a week of face-to-face training. And then we conduct the mock exam as well. So give yourself at least 2.5 weeks time for your exam when you come to Australia. So you have enough time to practice, you have enough time for face-to-face and the mock examinations.
Okay, but otherwise the face-to-face will be 5 days.
Face-to-face is 5 days, yes. And then there will be mock exam as well. So you will be tested on 10 different stations, just like in normal OSCE.
Okay, so the mock exam happen within the 5 days.
No, it will happen after 5 days of face-to-face so that you get some time to practice your skills. And once you practice your skills is when we do the mock test.
Okay, no. So can you tell me more about the discount that is going on?
For that, you need to send that email to that email address or contact in that WhatsApp number. So the admin people will be able to send you that.
I've been engaging you for almost 5 days now. So I was like, can you please send me the forms? And I haven't received them. But anyway, I will send another WhatsApp. Thank you so much. I'm looking forward
Thank you, Georgina. Thank you so
passing
much.
OSCE with you guys.
Thank you. I look forward to meeting you and talking to you in person. Is there anyone with any more questions, guys?
Yes,
Yeah,
sir.
I just wanted to highlight from Georgina's question, which she asked. We'll be having the session, the online session, which is 2.5 hour duration. However, if you're not able to make it because of your work commitments, if you're not able to attend live the online session, we also have a provision wherein you can view the sessions on the platform. It will be recorded. So all the sessions are recorded. So if you've not had the opportunity to attend it live, you can definitely attend or review the content from the recorded sessions. Yeah. Thank you.
Thank you, Reena ma'am. I would like to take a minute to thank everybody who has been commenting on our live, all my previous students, all our family members. They've been thanking us and they've been expressing their gratitude. Thank you, guys. I mean, I cannot be more proud to be here talking about your guys' success stories to our new batches, the students that are planning to join us. I am so overwhelmed by the responses that we get from our students who passed. And there was I think in the last OSCE, one of the students asked me, so don't you get tired? What do you get out of all these things? So what I did was I showed her a message that was sent by a student who passed the February exam. And I said, this is what keeps us going. You know, this is what it keeps us going. That is our motivation. That is our job satisfaction. So all those guys who have been commenting under the live, you guys are the reason why Geeta, me, Reena ma'am, Preeti, we all strive to succeed and train new and new batches. Thank you so much, guys. I'm ever grateful from the bottom of my heart. Now, just to give you guys a heads up, so don't forget to join us when we have a live with our passers from Fiji on the next week. It's on next week. It's on 4th of May 2024 at 6 p.m. Sydney time. So they are a couple from Fiji. They both enrolled with us together, and they passed Nclex and OSCE with us, and they are waiting for their registration at the moment. They passed in January, so they will be sharing their experience to you guys. So please don't forget to join us there as well. Please subscribe to our Facebook page so that you'll be kept up to date with what's happening in the OSCE scenario in Australia and what we are up to, our new online classes, our face-to-face sessions, and all those things. And we always try to motivate you by presenting you our success stories. Those students who passed already, so that you take motivation from them. Are there any more questions for me before we end this? If you have any more questions and if you're not able to put it out there right now, please feel to send us an email or send us a message. We'll be more than happy to get in touch with you. All right. Thank you.
Thank you, Geeta ma'am. Thank you, Georgie. Thanks, everyone.
Ma'am, where are you? Join in. Let them see
Thanks, Reena
our
ma'am. Reena ma'am
motivators.
is- Thank you.
Thank you.
Thank you, guys, and good night, and God bless.
Hello, Miss Priya.